Pandemics, Preparing Ourselves for the Worst, a Nunatak Resource Associates Disaster Preparedness Training. What is a pandemic? It is defined as the worldwide spread of a new disease. This includes the flu, H1N1, viral hemorrhagic fever, and others. Influenza pandemic occurs when a new influenza virus emerges and spreads around the world, and most people do not have this immunity. Viruses that have caused past pandemics typically originated from animal influenza viruses. With the swine flu, the CDC concentrated on creating the wrong vaccine that year. The CDC reported that most of the deaths related to the H1N1 pandemic actually had to do with people being over the age of 65 and up. Just some more information about pandemics. The Zika virus is spread mostly by the bite of an infected Aedes species mosquito. These mosquitoes bite during the day and the night. They can be transmitted through mosquito bites, unprotected sex, and blood transfusions. They can be transferred from mom to fetus and cause microcephaly. Symptoms include fever, rash, headaches, joint pain, red eyes, and muscle pain. Although not common around here, monitoring our communities for people who have recently traveled or went on vacations. They may be bringing back something that they don't necessarily want to. Pandemics. To continue talking about pandemics, we'll discuss Ebola a little bit. It wasn't so much a pandemic here, as only 11 people were treated, but it was a pandemic in West African countries. 2 nurses were treated for Ebola. This talks about how our contact and our precautions really does play a role in how we contain and eliminate pandemics. Scientists believe that initial outbreak begins with a spillover effect from contact with an infected animal. The virus spreads through direct contact, such as through broken skin or mucous membranes in the eyes, nose, or mouth, with blood or body fluids, contaminated objects, and syringes. Symptoms include fever, severe headache, muscle pain, weakness, fatigue, vomiting, diarrhea, stomach pain, and unexplained bruising and bleeding. Prevention is hand hygiene. Influenza milestones. This is a great slide that just discusses the flu and the vaccine in relation to pandemics in our discussion today. Why is understanding a pandemic important in our roles as community workers? We provide guidance and training to all of our members, our caregivers, and family. And through this, experience is gained through outbreak response, managing clinical and laboratory environments, networking with subject matter experts, and developing partnerships with stakeholders. And in our work and in our lives, our stakeholders are our community, our caregivers, and our families. We are each other's stakeholders, and because of this, we owe each other to be able to give them the correct and the greatest information available. What is the plan? The plan is to use proven evidence-based research to train. Ensure that current scientific knowledge is maintained in order to apply the most appropriate guidance for treatment, control, and safety to mitigate the risk regardless of the source of the disease event. And hand hygiene, hand hygiene, hand hygiene. I cannot stress enough the importance of proper hand washing technique. Before a pandemic, we should store a 2-week supply of food and water. Periodically check your regular prescription drugs to ensure continuous supply in your home. Have any non-prescription drugs and other health supplies on hand, including pain relievers, stomach remedies, cough and cold medicines, fluids with electrolytes, and vitamins. In addition, we should get copies and maintain electronic versions of health records from doctors, hospitals, pharmacies, and other sources and store them for personal reference. Get help accessing electronic health records. Talk with family members and loved ones about how they would be cared for if they got sick, and what would be needed to care for them in your home. During a pandemic, we need to limit the spread of germs and prevent infection. Hand hygiene, again. Avoid close contact with people who are sick. When you are sick, keep your distance from others to protect them from getting sick too. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick. Wash your hands. Washing your hands often will help protect you from germs. Avoid touching your eyes, nose, or mouth. Practice other good health habits. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. These are the steps to washing your hands. This is a great guide to just go ahead and show everyone that you need to on how to properly wash your hands. It works for everyone. It works for the young, the old, the developmentally and intellectually disabled. It's non-discriminatory. It's pretty easy to teach. You sing happy birthday twice for approximately 20 seconds, and you lather under nails and around all surfaces under clean running water. You will dry with a clean paper towel or air dry. With a paper towel is has been shown to be the most effective. And stats, it's the one way of preventing disease. It is based on collected data, which means it is evidence-based research. Pandemic quiz. What is a pandemic? A disease that spreads locally, slowly, and is easy to cure? An infestation of baby pandas in the neighborhood? The spread of a new worldwide disease or a vaccine used to treat the flu? Number 2, H1N1 is considered a pandemic because there were only a few fatalities, the CDC was involved, it was an unknown disease beforehand and spread rapidly across the globe, or was it easily treatable? Number 3, the best way to prevent a pandemic is to wash your hands, avoid contact with friends and family, avoid vaccinations, or take multivitamins. Last but not least, before a pandemic, you should do all of the following except get your vaccinations, practice hand hygiene, avoid family and friends when sick, store only enough food and water for a day. Here are some useful links and resources. Definitely use them and click on them. Bring up this whole PowerPoint and teach our caregivers and members all about it. Totally worth it. Any questions, you can always email me at nichols@nonotuck.com. Feel free to go over and review these references for your own information and get a deeper learning about pandemics.